Hello, everyone. Well, I want to add my thanks to you for coming to this conference on neglected tropical diseases. I think we have learned this morning that the common denominator for these diseases is really poverty. So I guess we have the great task of going into poverty issues to be able to address a lot of these diseases from the root cause rather than the symptoms. My name is Tony Payan. I'm the director of the Mexico Center here at the Baker Institute, and it's a pleasure for the Mexico Center to collaborate with the Center for Health and Biosciences in organizing this conference. Thank you, Vivian. Thank you, Kirsten, and everybody at the Center for Health and Biosciences. It is my pleasure to introduce to you the speaker for our luncheon, Sarah Davis. She is the Texas State Representative from District 134. The Honorable Sarah Davis is a three-term Texas State Representative in District 134, not very far from the university, actually. Davis graduated from John Foster Dulles High School in Sugar Land in 1994. In college, she was a member of the Baylor University debate team. No wonder you ended up in Congress. After receiving a bachelor's degree in economics from Baylor in 1998, she went on to earn her law degree from the University of Houston in 2001. Davis is an accomplished and successful attorney devoting her career to defending against personal injury lawsuits. She is a partner with the national law firm of Lewis, Brisbois, Bisgard, and Smith. Sarah's clients include individuals, local businesses, and Fortune 500 companies. Davis was first elected to the Texas House of Representatives in 2010 and served on the Public Health and Judiciary and Civil Jurisprudence committees. Davis was re-elected in 2012 and 2014 and currently serves on the House General Investigating and Ethics, Public Health, Calendars, and Appropriations committees. She served on the Appropriations Subcommittee dealing with Health and Human Services and also chaired the Appropriations Subcommittee on Budget Transparency and Reform. This past session, Speaker Strauss selected Representative Davis to serve as a conferee on the Budget Conference Committee as one of 5 House members charged with reconciling the House and Senate budgets. During the past 84th Texas Legislative session, Davis wrote and helped pass the House Bill 2055, which established a Sentinel surveillance program for emerging and neglected tropical diseases. Please help me thank and welcome Honorable Sarah Davis.
Well, good afternoon. Thank you very much for that lovely introduction. I always feel a little embarrassed hearing about myself. But it's a great honor to be here with you this afternoon. Honestly, to be invited to participate in a Baker Institute conference is a high honor here in Houston. And I feel, quite frankly, a little unqualified to stand on the stage among so many of you in the audience who have demonstrated such knowledge, research, and commitment to eradicating neglected tropical disease that each of you have demonstrated. So I'm very humbled to be in your presence and grateful for each of your contributions to such a worthy cause. Now, as a politician, we usually think we're the smartest people in the room whenever we're in one with more than 2 people. But honestly, not even my politician's ego will allow me to entertain such a notion in this room today. It really is overwhelming to be surrounded by so many of you. So no, I really don't consider myself having been invited to speak on the science of neglected tropical diseases. I believe I was invited to speak today because I passed a bill that you just heard in the Texas Legislature, and I think it will be of interest to everyone in this room. And I will say that I was able to pass that bill in no small part thanks to several people in this room, the Immunization Partnership, Dr. Hotez, Dr. Herrick. I mean, mean, and I'm going to get into this, but passing a piece of legislation is not an easy thing, and it's not done alone. Now, I could stand here and I could commend all of you and the leaders of this conference for choosing the wonderful city of Houston to host this conference as really being the perfect place for such a conference on neglected tropical diseases, because as you all know, Houston and Texas have pockets of poverty and a tropical climate that really make us vulnerable to the spread of neglected tropical diseases. And I could fumble my way through trying to pronounce things like Chagas and dengue fever, and if you watched me lay out this bill in public health, you'll know how horribly well I can butcher those words. But all that will be done in an effort really to try and convince you that I'm far more knowledgeable on this subject than I really am. Although I can pronounce Ebola, and I'd like to thank Dallas for that. Since there's a lot of Texans in the room, I figured you'd get the Houston versus Texas joke. I asked a couple people, mostly Houston audience. But the truth is that there really is, I think, almost nothing that I can tell you or share with you about this subject that you already don't know or are about to learn this afternoon. So as they say as a lawyer, I'm just a poor country lawyer. All lawyers make that joke, which is also a polite way of saying at the end, we're going to do some Q&A, and so I ask that you not ask me any math or science questions, because so I may not know a lot about the science of disease, although I will say I am a patient at MD Anderson, having been diagnosed with breast cancer at the age of 32. So my perspective on health policy in large part is guided by my personal experience as a patient, and then of course by the fact that I have the high honor of representing the greatest medical center in the world, the Texas Medical Center, which does include Rice. So yes, you are all in my house district. Welcome. But what I thought, what I did know about, a thing or two about, which is the politics of the Texas Legislature. And so this afternoon, I thought I would speak to you about the process and honestly how vital a role each of you play in that process. But before we get there, I always like to start with what I call the Texas Legislature 101, because even though I know that I am in a room filled with the brightest people in the state, I have found that understanding or even knowing what the Texas Legislature is seems to be dwindling. We hear on the news a lot about the federal government, and I am definitely not in the federal government. We say everything is bigger in Texas, and in fact, I completely agree with that, with the one exception, which is government. Texans do not like big government. And so in Texas, the legislature meets once every other year for 140 days. Think about that. 140 days every other year is the amount of time that we have to pass all the legislation that we can get passed and to develop a 2-year budget. We meet for 140 days. We actually are constitutionally prohibited from even voting on legislation the first 60 days, because that's typically when committees are being formed and you start having bills. So we're talking about a very limited, compressed amount of time to actually get legislation through. Now, this can be extended, of course, if the governor calls a special session. And so far, Senator Garcia, we have not been called back for a special session. I'm in my third term, but I've experienced 5 special sessions already. So hopefully we will not need to do that. Now, the Texas Legislature is similar to the federal government, and that is comprised of 2 chambers: the Senate, which has 31 members, 20 Republicans, 11 Democrats, and the House of Representatives, which has 150 members, one of which is myself, with 98 Republicans and 52 Democrats. Now, I am giving the partisan breakdown of the legislature without any type of a partisan intent, but so that you understand sort of the lay of the land of what the legislature is. And I know we have in the room some folks that are engaged in advocacy, and there may be others who are interested in stepping into an advocacy role. So I think it's important that you do understand know your audience, as they say. And the audience in the Texas Legislature is a very conservative audience. So you'll need to be mindful of that whenever you start coming to Austin, which I'm sure all of you will during the next legislative session. So each House member, like myself, we represent 175,000 people, give or take, and we're paid the large salary of $7,200 per year. So that's $600 a month before taxes. So truly, and that's the same for the senators, so truly your House member, your state House members and your state senators are public servants, I think in every sense of the word. I think probably the biggest difference between what the state legislature does and what the federal houses do is I think we get along actually a lot better in Texas government. Although I do think that is starting to change. I think that there's a lot of frustration and angst going on with the federal government that bleeds down. But generally, remember, we're locked into a room for 140 days with each other. We eat our meals together. We take breaks together. We do not align ourselves by party on the floor of the House like you see in Congress, where you have Republicans on one side and Democrats on the other. We actually choose where we sit on the floor. In fact, my desk mate is a Democrat from El Paso, so she has a very different constituency than I do, but that I think makes for really good collaboration and better policy when we have the freedom to be able to exchange ideas and help to understand the impacts that policy decisions are going to have on different constituencies. I also would just would like to add that although I am interested in your position on the Iran deal, I do not have a vote on that. We get a lot of calls about that. I also cannot vote on the debt limit. And I can understand your fear about the government shutdown, but again, I don't vote on that. And if you're really upset about the state of the streets around Rice, that I'm sure that you all drove again, let me refer you to your city councilwoman, because that is also not the state government. But the truth is, I think the vast majority of what we do is nonpartisan. Most of what you read in the newspapers are the handful of highly partisan issues. But I think for the most part, we work very well together. Senator Garcia is here this afternoon, and the senator and I have worked on several bills together where I was her House sponsor or she was my Senate sponsor. And so we really do, I think, try and cross party lines in instances when we think that's what's going to be in the best interest for the state of Texas. Now, for any bill to be passed, it has to pass out of the House and the Senate, and it has to be signed by the governor. Now, the two bills that the House passes and the Senate pass have to be exact. And if they are not exact, so like if I pass a great bill and the Senate tries to muck it up, then we have the appointment of what's called a conference committee, and you heard reference to that a little earlier. And the conference committee will then meet. The Speaker and the Lieutenant Governor appoint a conference committee of usually 5 members from the House and 5 from the Senate, and then they meet to reconcile the differences. But at the end of the day, the only bill we're constitutionally required to pass is a 2-year budget. And we are prohibited from appropriating money beyond that 2-year budget. That being said, this past session we started in January 12th, I believe is the day we were sworn in, and we adjourned sine die, which is legislative speak, for the last day of session. And we saw more than 6,300 bills and resolutions actually being filed. About 1,300 of those were adopted and sent to the governor for signature. A lot of them were actually signed. There were some vetoes, but we're not going to talk about some of the vetoes. Now, of course, some of those bills that the governor signed were mine, including one that we've already referenced, which is House Bill 2055. So in a federal government, every bill has a name. like the Affordable Care Act, or any type of name. In Texas Legislature, our bills don't have names except for pet names that we may give them within an office. So we don't refer to, there's no formal bill name. So we refer to them mostly by numbers. So House Bill 2055 establishes a sentinel surveillance system to collect high-quality data on emerging and neglected tropical diseases, which will hopefully serve as a source for professional education to increase public safety and awareness of the symptoms and prevalence of these diseases. So specifically, what this bill does is the bill requires a program to identify by sentinel surveillance individuals who are infected with emerging or neglected tropical diseases, and to maintain a central database of laboratory confirmed cases of emerging and neglected tropical diseases. And by the way, that's a very difficult thing in the legislature, to have a database created and maintained with our citizens' medical information. That's one of the most controversial things we deal with in public health, besides vaccinations, are in fact databases. The bill also it will expected to be used to investigate the incidence and trends of emerging and neglected tropical diseases. And the bill defines an emerging disease as a disease that is appearing in a specific population for the first time, or that is increasing in incidence or geographic range. And neglected tropical disease is defined as a parasitic or bacterial disease that occurs solely or principally in the tropics, is largely endemic in the developing world, and has the potential to spread through international trade or travel. I believe that having this sentinel surveillance system is a far superior option as opposed to passive surveillance. A sentinel system deliberately involves only a limited network of carefully selected reporting sites, which can be used to signal trends, identify outbreaks, and monitor the burden of disease in a community, hoping to help to provide rapid economic alternatives to other surveillance methods. Now, that's very vague, and I know that there could be a lot of questions about the specifics of this bill. Most bills, especially bills like this, give rule-making authority, because this bill is essentially an instruction to the Health and Human Services Commission to create the program. And so the actual rules for this program are being written right now. I believe that the rules are supposed to be published on November 1st. So we don't, if you ask too many questions, I might have to say I'm not advised, which is legislative speak for I don't know yet. But as a result, so I do think this bill will increase early detection and treatment, providing a resource of valuable information to our public health professionals. And luckily, this bill passed the House. It sailed through the House because it had such a great House sponsor, as well as the Senate, and was signed by Governor Abbott into law. But this legislation began its journey. When it began its journey, it was far before June or January, when the legislature went into session. Believe it or not, most legislators like myself, we don't kind of sit around thinking about different laws that we can pass. But typically, our ideas and our legislations come directly from constituent concerns, advocacy organizations, and in particular with me, institutions that I represent, since there are a lot of institutions within the Texas Medical Center. Now, in the case of HB 2055, the bill that we've been discussing, I actually began meeting in the interim, which is what we call the time when we're not in session. I began meeting in the interim with the Immunization Partnership, who actually initially brought this legislation and the idea of this legislation to me. And we started having these discussions months before session, probably a year at least before the session even started. And it was during the course of those discussions that I was presented the opportunity to consider carrying the legislation, and I was happy to do so. So you got me as your House sponsor, and so I filed the bill only House members and senators can file legislation, the governor cannot, and citizens cannot. So I filed the bill, and all bills are referred to a standing committee. So you heard I'm on general investigating and ethics, I'm on calendars, I'm on appropriations, and I'm on public health. If you are my constituent, you got your $7,200 worth out of me this past session, because I felt like I was on every single committee. But luckily, of course, this bill was referred to public health, on which I sit, and I presented the bill to the public health committee. We had several supporters come and testify in favor of the bill. Dr. Hotez submitted written testimony in support of the bill, and I got to tell you, one of the few times that this has ever occurred, no one testified against the bill, which generally there is someone opposed to everything. So it was pretty shocking that that occurred. But I was quite pleased. So the bill was voted out of public health favorably. So we passed out of the public health committee. So here comes the complicated part. Bills, even if they pass out of a standing committee, they have to go through a calendars committee. And I serve on the calendars, two basic calendars committee, the general calendar and local and consent. So those who serve on the calendars committee are ultimately the gatekeepers for all legislation that gets put on the floor of the House. We literally vote to determine which bills get voted on. So during the session, I'm everybody's best friend, and at the end of the session, everybody's angry if they didn't get their bill. But you have to think strategically about where you're going to send your bill. Because if a bill goes to the floor of the House on the general calendars, it's going to be subject to debate, and it could be endless debate. We debated the budget for more than 18 hours the first time we laid out the budget. But seeing as how there was absolutely zero opposition that testified in the committee, and I think you could consider it local, since we're going to be developing very local sites, the decision was made to send this to the local and consent calendar. And that became very important because if the bill had gone to the general calendar, I can guarantee you there would be at least 25 plus amendments, because there was a little issue Dallas had with Ebola, and so there were probably no less than 50 bills that had been filed dealing with Ebola. And then there would, like I said, there would be the general amendments and opposition dealing with the collection of healthcare data and the storage of healthcare data in a database. So when you send a bill to the local and consent calendar, there is literally no debate. You're called up, you lay out the bill usually in 1 or 2 words. I am not joking. Most bills, and you lay out a bill, you explain the bill, you tell the members what the bill does. Members go to the back mic, ask you questions, argue with you, debate you. Local and consent, you're acknowledged to lay out your bill. You say, House Bill 2055, and then they say, okay, move on. So no objections. And so there's no real room for debate, which made it very important for this bill to stay kind of pure. Even though I think it was probably one of the most important bills that we passed it really quietly. Just kind of slipped it in. But I think that was the best strategy to take for this particular process. So every bill that we are looking at trying to pass, there's a lot of different balls in the air in terms of how we can best get that legislation through. It's all very political, as you can imagine. So even though I think that's a very important piece of legislation, and I think Texas is clearly a leader, Dr. Hotez pointed out that this is the first piece of legislation that has passed in the country dealing with neglected tropical diseases, and it comes out of Texas. And I think that it makes sense given our climate and our population, but I also just think it makes sense because Texas always wants to be a leader, although what we do not want to be the leader on is having the least vaccinated children in the nation, which was a topic of discussion at our lunch table. So that will be probably a discussion that will carry on next session. But at the end of the day, I think actually probably the most important piece of legislation that we pass, and the only one we're required to pass, is the budget. And I can report that in this past session, we passed a $210 billion budget. Now we're budgeting for 2-year cycles. So the budget we wrote in 2015 was for the 16-17 cycle. So we're always a couple years behind. Now, a portion of that money appropriated of the $210 billion was appropriated for a strategy called Preparedness and Prevention for Infectious Disease Prevention, Epidemiology, and Surveillance. And all that falls under the infectious disease strategy in the budget. Now, that strategy in the budget takes a holistic approach to preventing and controlling the spread of communicable diseases in Texas. And so for that reason, you're not going to find a specific strategy in the budget for neglected tropical diseases, but they are assumed, neglected tropical diseases are included within the appropriation. So for fiscal year 2016, for all budget conscious people in the room, we appropriated $26,558,848 for the infectious disease strategy. We appropriated $24,788,000 for fiscal year 17. So that's a total of $51,347,695 for the biennium, which is a pretty good chunk of change for the state to spend. Additionally, and in response to what had happened in Dallas, we were able to secure $33,570,000 for a strategy called Ebola and High Consequence Infectious Disease, which I do think that neglected tropical diseases could also capture some funds in that pot of money. So I think that Texas made a pretty significant investment and resources in the area of disease and disease prevention. And I will say that most of the funding and the mechanisms and designing of the funding was done during the conference committee process. And that was something that I was a part of. I was the budget conferee for Article 2 of the budget, which is all of Health and Human Services. And so we tinkered a lot with making sure that we were putting some resources in where I thought they needed to be. And so even though I actually get the credit for the creation of the Sentinel site system, and I like to brag about being a conferee on the budget and securing the funding, the truth is I could not have passed, and nor would I even have thought about passing legislation like this if it hadn't been for advocates that are in this room today. So in other words, you. I know each of you are very busy. You're researchers and you're physicians and you're raising families and you have very precious time left, but I would like to add politics to your to-do list. I would encourage each of you to figure out who is your representative. You can literally Google who represents me, and they will give you a list. And you should start contacting them, and you should start contacting us now during the interim, because once we're sworn in, there's just really almost no time to have meetings that last literally any longer than 3 minutes, because we're just back to back. But the most important thing you can do is vote. I don't want to embarrass anybody by asking how many people voted in the last primary election, but I have asked the question to groups and have found very, very few people that do. And the number will be slightly larger if I ask if you voted in the last general election, and if I ask when is the next election. So lots of people are like sort of panicked. So I'm not going to do that to you, but I will say that you have to engage in the political process. Everything that you're doing on the research side is so important, but if you don't have the advocacy component, you're not going to see policy written that reflects what you do. So you better engage in the political process, or it will, I promise you, engage you, and you may not be happy with what the results are. So I'm happy to try and dodge any questions you have. Again, no math or science, but I'll do my best.
Thank you. Well, since we're in the teaching moment, I think it's important that we understand, especially those of us who work in think tanks, that there is really an iron quadrangle, I suppose. We academics and researchers often do our work, and then, as we heard this morning, we publish, and then we read each other, and then we publish some more, get a grant, publish, and then read each other. But I think in a place like the Baker Institute, we obviously try to establish bridges between the advocacy community, civil society, the academic and researching community, and of course, two other groups that I think are important in this quadrangle, and one of them is, of course, public figures like yourself who represent districts and people and can introduce these bills to make a difference, and of course, the private sector, which also can be an important ally in developing solutions, marketable solutions to our problems. And I think this is one of the great virtues of the Baker Institute. Before I cede the floor to you, though, I have a couple of questions, and I'll put them forth together, given that we have only about 10 minutes for questions. One of them is, what's next? Have you thought about the next steps? Is there anything else that this bill is missing, needs? Obviously, the funding for the 2 years after these 2 years, and what else?
The what's next really can't be answered until we get the final rules that have been written by the agency, and we haven't seen those yet. Obviously, funding is going to be necessary. This bill it had no fiscal note, which means it doesn't cost anything, but it actually does require the state to prohibit the healthcare facilities for any costs that they incur by collecting the data. I was advised by all the agencies involved that there would be no reimbursement, and they could use it within existing sources, which is why this bill was not accompanied by a separate appropriation rider. But at this point, it's hard for me to know. We'll need to wait and see what the rules look like, and then I'm sure I'll be hearing from Dr. Hotez and many others about what they think about those rules, and we'll go from there. You see that in a lot of legislation, the rulemaking authority kind of becomes the guts, and you have to be very careful and watch what the agency's doing, because and I'm not trying to speak ill of government agencies, because they have a lot of the folks that work there have good hearts and want to do the best, but can inadvertently completely undermine the intent of your bill. And if you are not paying attention, that can happen. So we just kind of have to wait and see. We should get the rules on November 1st, but the agencies are a little bit behind, so it may not be November 1st.
Great. And one another question that we had in our discussions was, when I was in El Paso, I served in the Regional Mobility Authority. That was, I think, Bill 792. Now that you're talking about numbers, and the RMAs are essentially for infrastructure projects, and I served in that committee, proudly for 5 years in El Paso. And that included a provision to be able to invest across the border in Mexico if it was demonstrated that Texas somehow received a benefit. Is there any such provision in this bill to invest in monitoring what's going on the other side, and collaborating and working and establishing a system that actually crosses the border?
Not in this bill, no. This is applicable to only healthcare facilities as defined in code, which does not include facilities outside the United States. So that would be something that we could certainly look into in the next session, although I would say that it would be somewhat of a challenge to convince the Texas Legislature to appropriate money to be expended outside of the state of Texas. I think that would be a very uphill battle.
Thank you. Questions from Vivian. Just raise your hand, I'll identify you, and we'll direct the microphone to you. Vivian.
Representative Davis, thank you so much for passing this bill. You've been so helpful to the Texas Medical Center, and it just shows that you don't just care about serving your most powerful constituents, but some of the most vulnerable ones as well. We had a speaker last night, and one of the members of the audience mentioned that one of the best sources of funding for helping low-income adults who might be suffering from NTDs here in Texas would be an expansion of the Medicaid program, which Texas has so far not decided to take. And I'm just, and the Deputy Assistant to Secretary for Global Health thought that was a terrific idea as well. I'm just wondering if you think there is any possibility of some other solution coming up during the next legislative session.
Well, that's a great question. It's the million-dollar question that those of us who deal with health policy ask every day during session, especially in light of the fact that our 1115 waiver is about to expire, and we're in jeopardy of losing a lot of funding for our hospitals. So we're working on the answer to that question, but as I stand here today, I would say the political environment in Austin would be that an expansion of Medicaid is probably just not on the table at all. There's just not the political will for that. But I certainly acknowledge the challenges we face. Our hospitals, our safety net hospitals, and our trauma hospitals, we're facing a lot of issues. I'm sure a lot of you read about that Ben Taub may lose its level 1 trauma designation, and probably folks are going to present at these safety net hospitals and the trauma hospitals for the first time with these neglected tropical diseases. That's where they're going to present. Now, in conference committee, outside of the normal sort of budget process, I was able to negotiate an additional $221 million allocation just for our safety net and our trauma hospitals as part of an add-on rate, and an additional $25 million of straight funding to our rural hospitals. But that's a piecemeal approach, and we are heading, I think, into a perfect storm. Next session, I think we're going to see, for the first time in Texas history, the largest portion of the budget will be for health and human services. Right now, we're number 2, second only to public education. We're working on it, but in terms of just the political feasibility of quote, Medicaid expansion, I mean, no one's going to have a serious discussion about that. And Senator's shaking her head. I mean, I'm sure she's an advocate for Medicaid expansion.
We're not even discussing it in the Senate.
Yeah.
No bills, nothing. They just said, we are not going to talk about it.
Yeah.
That's what the leadership said.
Right. So.
Still file bills, but we knew they were going nowhere.
Yeah. There's just, that's not a political fight that's even going to be fought, I think.
Thank you. Any other questions? Yeah, Peter.
So, first of all, Representative Davis and Senator Garcia, thank you so much for your leadership, not only on this neglected disease legislation, but in general, and being such amazing advocates for Texas Medical Center and Rice. My question is, something interesting has happened over the last 2 or 3 years that I've been here, which is I have a pretty steady stream now of PhD graduate students, master's students, and medical students who want to get more involved in public engagement, and that the interest, not only in public engagement, but public service and public policy, seems to be at an all-time high. And I know that there would be tremendous interest if the opportunity was there to spend some time in Austin and see how bills are enacted and how this is moving forward. I think we have an opportunity to create, I know the interest is there, if we could just create the right mechanism and venue to get these young people involved in public service and engagement. Any thoughts about that?
Well, I think you're right that there is a great level of interest. Austin, or the LBJ school in Austin has an internship program where their students who are working on their master's can actually receive credit if they do it, if they can get hired by a legislator and be an intern for an entire session. And so I had a candidate who's working on his master's as an intern in my office, and he got credit and they gave him a stipend, because I couldn't, in our office, unlike the Senate, who has these huge budgets for staff, in the House we have a very small operating budget. So I have one person in Austin and one person in Houston in the district, and everybody else that works in the office are unpaid interns. But University of Houston offers a similar program where if you can get an internship in an office, they will pay you a stipend and you get credit. My current district director interned for me twice, and when my district director decided to leave, she was a natural fit because she had been interning in my office. So I think there's a lot of, there are schools that do it. Texas A&M also has a similar type program. So, but it never occurred to me to involve the medical schools or the public health schools. So I think that is actually a really interesting idea. I speak every semester. UT Health Science and Baylor College of Medicine, both in the medical center, they have a class called the Business of Medicine, and so I come every semester and give sort of a lecture about why you need to be involved politically, all the things that we deal with. I always say something like, I exercise control over everything from your budget to the badge that you wear to get into your hospital, because I literally do. I have passed 2 badge bills regulating what can be on that badge. But I think but the medical students are always very interested, especially once they find out how much the legislature really does get involved in what they do. So that might be something that we should visit with the institutions about, to see if there's a way that the students could get some type of a credit. But like I said, they would probably need to get some type of a stipend too, because it's not cheap to live in Austin. But there are programs out there, but you're right, you don't see one that I'm aware of one that is medical, has a medical orientation to it.
Great. Before we file in back to the auditorium for our next session, please help me thank the Honorable Sarah Davis. Thank you.